going. So it's saying connecting to a live stream. This is, I never know. I wish there was like TV where they have like, you are live. So you never really quite know. But I'm assuming I'm live right now on YouTube. Happy Clear Vision Wednesday time. I'm Claudia Mühlenweg, the holistic vision coach, creator of the Natural Clear Vision method. And today's topic is a really important one. And I think affects a lot of us, if not everybody to a certain degree. And I have a special guest here talking about this topic. And we call it the root cause of blurry vision with Dr. Tricia Pingel. Let me bring her on. Hi, Tricia.
Hi, how are you?
I'm good. So, we don't have to make it a big secret, but that root cause of blurry vision is stress, right? So you will tell us all about stress and why this is such an issue, because most people don't think that stress is just this bad thing, but it doesn't really has anything to do with your vision. So tell us a little bit, because you are known as the Adrenal Whisperer. Your focus on stress and cortisol and help your patients get better and recover from all these problems. But tell us a little, how did you get into this? How did you get into this specific area?
Yeah, it's interesting. It's funny how in hindsight you look back at your story and you're like, wow, okay, I see how I got here. But I started working from the time I was born, essentially. I was born into the modeling industry. My first paycheck, I was 9 months old. And I was taught, like many of you out there, show up, do your job, work hard, power through, don't show weakness, who cares if you don't feel well, go to work, it doesn't matter. You don't worry about you, worry about everybody else. And so throughout my life, I continued with that, just charging forward, into teenage years and into young adulthood, and losing my dad and losing my mom and losing my grandparents and, medical school and marriage and kids. And I think so many of us are taught that's just normal. That's life. Deal. Just keep moving forward. There's nothing you can do about it anyway. And we start to have this change in our body that happens from that. And I experienced all of that. I had stomach aches, I had menstrual cycle changes, anxiety, depression. We can talk a little bit about my vision here shortly, about how that was impacted through med school and whatnot. But all these symptoms, and I kept going to the doctor and they're like, oh, it's normal. Like, this is normal. Welcome to adulthood, lady. There's nothing you can do about it. And it wasn't until truly, I went through med school. I knew I loved the endocrine system. I loved it so much because in a moment's notice, you can change it. The body adapts so quickly. You can change from different nervous systems in just a few minutes and change your hormones in just a few minutes. And I loved that. But it wasn't until I was close to 40 years old and my mom was dying of cancer and I had to make a choice. Do I want to be present with my family, or do I want to continue to power through and do everything right and see all my patients and be a great mom and be perfect at everything? And I think it just came to a head and my adrenals just said, that's it. Like, you're done. You can't do this anymore. You have to make a choice to value yourself. And I did. And when I did that and I started to really focus on really what's in my control, what's not in my control, what's important to me. And honestly, Claudia, what's my legacy, right? My parents were gone. My grandparents were gone. They all died young, not knowing they were going to, and they have really only what they were here and they did at that time to show for it. So I started to say, well, what do I want my life to be? What do I want to pass on to my children if my time is up tomorrow? And when I made that shift, my health shifted in a positive way. My hair started to grow. My nails came back. My weight was better managed. My nutrition improved. My gut health improved. My mood improved. My hormone cycles improved. My vision improved. All these things started to happen. And I was like, wow, how many of us, as women, as men, as parents, as type A personalities, how many of us spend so much time worrying about everything else to the demise of our health? And when I was asked to write a book in 2014 on this, I drew a connection between cortisol and the top conditions in our country that are killing us: cancer, cardiovascular disease, and even as far as just symptoms that are highly medicated: anxiety, heartburn, depression, immune system disorders, sleep. And I was like, wow, cortisol has an impact, and a strong one, in every single system in our body, and is the one thing that there's no code for to treat. There's no protocol to treat it when you go to your primary care physician. Nobody knows what to do. It's just accepted as normal. So I'm not here to change that. It's not normal. And we need to start changing that. We need to start reconnecting with each other. We need to start reconnecting with our joy, our health, because when we do, our time on earth becomes just so much more, I don't know what to say other than kick-ass, like just incredible and fun. And that's what our lives should be while we're here, while we're blessed to be here.
I think I can so relate to your story. Not that I was ever a model, but basically the same thing, always powered through, basically raised 2 kids on my own. I moved to a different country. I mean, so many things. And we just worked in advertising, which is cut through industry. So I kind of really relate to that. And I think many listeners, I'm sure, type in the chat if that's you, can relate to that. So tell us a little bit about, you touched on this just a little bit, on your own vision and noticing how the stress affected your vision and what you've seen when you were when you took that break, right? When you were around 40, which is usually also a time where people's vision gets worse. So tell us a little bit about that.
Yeah, mine actually improved, which is great. When I got my first pair of glasses when I was 10, and they were Coke bottle thick, and I didn't want to wear them. And they didn't determine it until it's like I wasn't as present in school. Like my grades were slipping a little bit and it didn't make sense. And so I was always in the back of the room because, oddly enough, I look like an extrovert, and I am in some respects more now, but as a kid, I was not. I was very introverted because, once again, I was very concerned about what everyone else thought. It'd be the perfect little thing in the back of the room. Don't speak up. Don't dare raise your hand and say, I can't see, So I was given glasses, went to contacts, started to go to college. Vision continued to get worse. In hindsight, how much was I looking at a screen? How much stress was I under when I lost my dad and shoved that down into my soul and just powered through? And when I did start to heal my health after my mom's death, I started to notice that, one, I wasn't on screens more because I was prioritizing being outside, exercising. I was prioritizing better nutrition. I didn't find myself sitting a lot. And I do believe just blood flow and just being present in the moment helped a lot with regulating my sight. But also I went to the eye doctor, and I remember, I think I was about 43, 44. And they're like, wow, your prescription's improved. And I was like, it did? Look back now, I'm like, well, that's why, right? You don't think about it in the moment. And now, of course, as I'm approaching 50, now I'm starting to notice, and it's hilarious, I'm starting to notice that I'm doing this, right? Even though one of my prescriptions has improved, now I'm like, oh my gosh, I'm going to have to get readers. And what I've noticed even more in the last year is it's directly correlated to my stress level and how much I'm looking at the screen and how much I'm working. When I'm on vacation, I can see better. So I don't know, you start to think, wow, when I relax more, I see better. And I would challenge all of you out there to do that, because I'm curious how many of us notice that, if we start to consciously notice when we're calm, when we're doing things that access the parasympathetic nervous system, and we're really just in the moment, do we have such struggles with vision? And I have found I don't. It's when I push myself and I let go of that self-care that I start to notice, okay, I need my glasses to see. It's been interesting. It's all an evolution, health, right?
Oh, this show is about your expertise here, but it's interesting because that's why I don't teach eye exercises. If anything, I teach relax exercises, but even that, I don't like that word. But yeah, we don't need to say things. We need to relax more. But it's so interesting because what you talked about, you notice that, right? But a lot of people don't notice that. And we can definitely help you with the bottle thing, even when you are stressed. But there's an important thing that you just made. Your stress levels have an impact. And that's the first, I call that strains and gains. Like strains is like what you touched on screens, right? You said, on the other hand, when you're more outside, when you're moving more, like all those are what I would call gains. Those are making things better, more relaxed. So tell us a little bit about, for those of you that don't know, and I think it's really important. So we hear this word adrenals a lot, and adrenal fatigue and cortisol, but can you just explain this a little bit and how this can also tie into vision problems? But what are the adrenals and how do they work, and what is adrenal fatigue and how does that relate to potential eyesight problems, amongst other things, obviously?
Yeah. So the adrenals are located on top of our kidneys, okay? And they're little glands, and they are basically responsible for our survival. So if we look at it this way, if you're in the woods, you're taking a hike, you walk around a corner and there's a bear, right? Your body goes into this, what's called a fight or flight. Your heart rate goes up, your eyes focus in on the bear, all your metabolics focus on putting energy to the muscles so you can run, your blood pressure goes up, right? And we downregulate the things that aren't needed in that moment. We downregulate digestion, we downregulate going to the bathroom, absorbing nutrition, having sex and reproducing, all these things, repairing our cells, protecting our immune system, all go on the back burner so that we can run from a bear. And our body was absolutely beautifully built to do that, which is what's so amazing. But it was built to do that on short spurts, right? We see a bear, we get away from it. We don't see another bear forever. We can go about our hike and it's no big deal. But our society, unfortunately, with this evolution of technology and this get it now, we need to do it now, what we've done is we've started to create more and more bears because we're pushing ourselves to do more and more. We realize how intelligent we are and what we're capable of, so we continue to push ourselves. So as soon as we get away from one bear, there's another bear, and then there's another bear. So what happens is the body, the adrenal glands specifically, start to anticipate another bear. Okay, so we spend more time in a fight or flight. So even when we're technically relaxed, let's say we go to the spa, we get a massage, we're like, oh, we're doing self-care, but our brain is thinking during the massage, anyone? I'm sure everyone's like,
Yeah. Oh, yeah.
You try to meditate and it's like, oh, what do I have to do tomorrow? Did I order the groceries? Did so-and-so? Like your mind just goes, our body starts to anticipate that bear. Even when you take a nap, you start to fall asleep and your brain goes, wait, there was a bear from over there and I ran that way last time. I better do this way. So we start to have interruptions in our sleep, our energy production, our brain function. We have fluctuations in heart rate, in digestion, in nutritional absorption. And of course, we would have changes in vision, right? Because we're spending more time in that tunnel vision, that running from a bear, than we are seeing the periphery. We don't see literally and figuratively, we don't see the plants that we run by or the lake that we passed. We don't even always remember where we went. I mean, I'm guilty of this. I'm sure most of you are. You walk into a room and you're like, wait a minute. Why the heck am I here? Because you were in autopilot the whole time. You drive home and you make it home, but you don't actively remember driving home. Those are all signs that your body is stuck in a fight or flight. It's stuck in an anticipatory state. It's thinking about the bear. And our body cannot do the things it needs to do, like see clearly, digest our food, get proper rest and repair when it's in that fight or flight. In fact, there was a stat, and I need to pull the study up because I need to cite exactly where it came from, but it was to this effect. It was something we're supposed to spend 80% of our time in rest and digest phase or in parasympathetic activity. But we spend on average 80% or more in fight or flight. And then we wonder, why are we forgetting things? Why are we gaining weight? Why is our hair falling out? Why can't we see? Why aren't we getting proper rest? Why are we having heartburn and immune disorders and high blood pressure? Well, because we're not allowing our body to repair and do what it does best. And our body, and I know you agree with this, has the most amazing ability to heal. Amazing ability, but we can't do that when we're running from the bear because the bear will eat us. So we have to essentially train our brain to not run from that bear, to see it as a cub, to think about the positivity in it. What could we do with this experience? And when you do that, you see an improvement in all areas of your health, including vision.
Oh, I mean, I love the analogy of the bear because, first of all, it's more when people always talk about the saber-toothed tiger, which, we don't even have that anymore. But the bear, it's actually interesting. I remember hiking in Zion National Park. I got up super early and there was nobody on the trail. It was just me. And I had the best time. I crossed rivers and it was beautiful. And at some point I thought, like, are there mountain lions here? Are there I just had that thought because I've never, and I'm like, I thought about that bear. are there bears here? I didn't do any research. Like what the, and then the whole time I got so in my head, I got so anxious about like, what if there's a bear and I don't know what to do? And then on the way back, I had other people, but it's like so funny because I had the bear in my head. There was no bears in the trail.
And it's an interesting thing too, because I think most of us, when we think about stress or we think about our bears, we immediately go to these external things, divorce, job, parents, spouse, whatever, money problems. But the bear to our body could be a beep of a cell phone, anything that startles.
Right.
It could be a deficiency in a nutrient. So there's a difference between external stressors and internal stressors that I think is really interesting and maybe helpful if you'd like to dive into that. But both of these things feed into each other, and that causes our adrenal glands to constantly have this influx of cortisol. So if you think every time that bear approaches, no matter what it is, the cortisol is going whoop, and then it has to drop at some point. And that's where we start to see this roller coaster impact in our endocrine system. We start to see changes in progesterone, estrogen, testosterone. We see changes in energy productions, awake and sleep cycles. We see changes in mood. You feel really alone and depressed, and then you feel really anxious and overwhelmed, and there's almost no in between. We start to kind of get lost in this cycle of cortisol. And although it's something that is there to protect us, it can also take us down, and it's up to us to break that cycle by really understanding how that happens in the nervous systems, and how to control these stressors to the best of our ability, because they're obviously not, the external ones aren't going anywhere. The internal ones, you can do a ton to fix.
You talked a little bit about peripheral vision, and you talked about when we are in that fight or flight mode and the adrenals are on high alert, that we basically have that kind of focus on the bear, So obviously that is a huge issue in glaucoma. Glaucoma is an eye disease that is often correlated with age, or at least the doctors tell us it's all age-related. In glaucoma, you lose your peripheral vision, also top and bottom, but we probably in our daily lives, it's more important that, I would say it's not more important, but we don't really pay so much attention to the top periphery in our daily lives. I would say more to the sides. But is there, and often glaucoma, not always, but often glaucoma is connected to increased intraocular pressure, right? It's the pressure inside the eyeball. Can you find a connection there to the stress levels? Is that something that you have found, or that you can talk about?
Yeah, I mean, I'm not an ophthalmologist, so some of the details behind it, but I will tell you there is a ton of research. I mean, all it is a quick PubMed search on how they have shown that cortisol fluctuations and increase in cortisol will increase intraocular pressure. And it will also obviously reduce the periphery because you're running from a bear. Your body has to choose, am I going to live or am I going to die? And we've kind of built a society where everything is that it's either this or this. There's no in between. There's no balance. You're either this or that. And we have to get back to finding that balance that our body is used to incorporating. It's important for the pressure to go up when you need it to go up, but it can't be up when you're at rest, right? So there's a ton of research, not only on increased intraocular pressure, also on sensitivity to light. I hear that a lot in people that are really stressed out. They need to put their sunglasses on.
Oh, yeah.
Eye twitching. One of the number one complaints I get from people that they go, my eye twitches just randomly. And there are definite links to that with stress, and also with a lot of the nutrient deficiencies that come from stress, like low magnesium levels and electrolyte imbalances and things like that happen when you're running from a bear. And we've already talked about blurry vision. Eye strain and eye heaviness and eye fatigue is another one all the time, where it's like, oh, my eyes hurt. I hear that a lot. My eyes hurt. I'm just tired. And we think it's in our brain, but a lot of the times it is in our eyes. Our eyes work for us. They're the windows to the soul, right? And if our soul is stressed out and we're not connecting with our joy and our relaxed selves and our calm and connected self, it's going to be strained. And I think that's important. You had mentioned that earlier about who teaching people not to do exercises, but to, relax exercises, which I think, by the way, is a fabulous term, because I see this in the adrenal world all the time. You're tired. You're like, oh, I just need more caffeine. I just need an energy drink. Oh, I just need to stimulate. I need a stimulant. No, it's absolutely the opposite. You don't need a stimulant. You need to calm the body. When we're in a calm and connected state, we can do so much more, and we do it with more efficacy, and we also can take care of our health. We have this idea that we're supposed to push everything and stimulate everything in order to make it stronger. And I find it to be absolutely the opposite. We need to give ourselves a little bit of grace, and we need to recognize that our body needs rest and calm to work for us. If you're running a business and you have an employee and their hours are supposed to be 9 to 5 and you're working them 12 to 15 hours a day, how effective are they really? They're coming to work tired, they're missing details, they're not paying attention, they're in a bad mood, right? We do exactly the same thing when we push our body too far. We're bad employees for ourselves. We have to give the time off. We have to have our weekends. We have to. And we have to do those exercises and those things that calm our body down in order to not only improve our vision, but improve our health in general. We just don't do that enough.
No, we don't. And I think it's actually, I remember working with one of my very first clients many, many years ago. And we teach something called palming, right? Where you kind of you close your eyes and it's like a very deeply relaxed, but she said, I cannot relax. This is hard. Like she was so stressed out. So we had to actually do some movement first to kind of calm the whole nervous system down before we could actually rest. I think sometimes we need to nowadays learn how to relax and rest. And I actually definitely sometimes had that challenge. Like I need to move to relax.
Me too.
Like for me, just sitting down is actually not as effective. Or at least I need to move first. So I could very much relate to her. So I like what you said about eye twitching. I hear that also a lot. And so eye twitching, tell us a little bit about that. You said there is a correlation to, stress, obviously, but also to like what else? Low magnesium. What other things have you found? I have that very rarely, maybe once a year. One of my eyes suddenly starts twitching and then it stops. But I have it like literally like barely ever. But I know exactly what it feels like. It's like you can't control it. It's very strange.
It's very strange. And so let's talk about the nutritional aspect of that, because when you are running from a bear and your body is pumping out cortisol, there are direct nutrient deficiencies that occur. And when these happen, they cause internal stress on the body, which feeds this bear hamster wheel. Okay. And one of those in particular is magnesium deficiency. We also see other minerals like selenium, zinc. Those are big ones. So we start to have deficiencies in those. And magnesium is very involved not only in relaxation and in sleep, but it's also involved in muscle contraction. So I find a ton that when people say their eyes are twitching, number one, I know cortisol is in charge, not them, right? Which is something to pay attention to. They have a bear. And number two, that likely their magnesium is depleting. And this is a pretty common thing because magnesium is one of, if not one of the top nutrient deficiencies. I think it's well above 50%, 70, 80% of people are deficient in magnesium. And a lot of the times what you'll see is random twitching of the body as well. The eye takes it, I think, energetically, it's very interesting. Because like I said, the eyes are the window to the soul. And when you look in Eastern philosophies, you'll see that the adrenal glands are linked to the eyes quite a bit as well. And so it shows up in the eye as a twitch, which is something that annoys you enough to make you do something about it. When it twitches in your leg or you have restless legs, you're kind of like, oh, whatever, I'll just deal with it. And it could be a ton of other things. But when it shows up in the eye and that thing starts twitching, you're not going to ignore it. Something's going on. So what I like to look at when symptoms like that show up is one, I say, why is the body calling my attention to it enough to stop me from doing what I'm doing? Why did I stop running from the bear to say, wow, my eye is twitching? I don't like this. How do I stop it? The body's saying, pay attention. And one of the things to really pay attention to when that eye twitches is adrenal health and electrolyte and hydration. Those are three things. If your body's stopping you, you need to stop, take a look, and be like, what is going on here? Am I not getting the nutrition I need? And on that note, a very important part with stress is that, and I see this a lot too, is that people will say, well, I take everything, Dr. Pingel. I eat a nutrient diet. I take all these supplements. I'm taking magnesium. It's still twitching. I don't understand. And we have to remember that when we're running from that bear, we don't digest well. So you could be taking a ton of supplements, but if you don't address the cortisol, you're not going to absorb them or get the money out of them or the bioavailability out of them that you need in order to stop that. So, you know, I live in a world of people that try to do everything right? I mean, that's my demographic. We do everything. We're so invested in our health and we want to do everything. We want to be all in. And sometimes that's to our demise because cortisol is taking over and the bear is dictating whether or not we're going to absorb that magnesium or not. So just a little thought there for you perfectionists and overachievers out there, you know, that are saying, well, I'm taking magnesium and my eye is still twitching. The magnesium's good, but pay attention to the bear.
I love what you said, that because we can also get obsessed about optimizing our health and get really, and you know, definitely been guilty of that. I mean, no, we're not giving medical advice here, obviously, but I'm
Sure.
just curious because with magnesium, you hear there's so many forms of magnesium, right? And one person says, take this, take that. Have you found something, a form of magnesium that's specifically helpful for like the eye twitching and other problems, or is it really based on a like, you know, lab testing and figuring out, have you found one? Because there's so many versions of magnesiums, right? So many forms.
Yeah, that's a great question. And I get asked this question all the time. It's a great one. So there are different forms of magnesium, and essentially just basic understanding is you have your mineral, your magnesium, and it needs to bind with something, right? So what's inside the supplement is what it's bound with. So when you see something like magnesium oxide, that's magnesium attached to an oxide, magnesium picolinate or orotate or glycinate or taurate or whatever. And they do have different bioavailabilities. And depending on the situation, you may use different forms. But I will tell you, when it comes to stress reduction and the eye twitching, I love to use it in a glycinate form, magnesium glycinate. And the reason being is that glycinate is glycine. And glycine has a very calming effect on the nervous system. So you kind of get two bangs for your buck. Not only do they, when they're absorbed, break apart and absorb into the body well, but it also gives you a calming effect. And that's great. So I've had other people use magnesium taurate, orotate. What I would avoid with absolute cause are sulfate and oxide. You're not getting anything out of that except diarrhea, which nobody wants.
Okay, well, that's helpful.
Yeah. Magnesium glycinate is absolutely my favorite for that. So that would be my recommendation. And it's available everywhere. You just have to read the labels.
Okay,
You know?
great. I think that is very helpful because again, there's so much confusing information out there. I want to get back to the topic of light sensitivity because obviously that's something that I hear a lot about. I help people reduce their light sensitivity. It's often connected to headaches, some people are very, you know, I mean, I always want to say there is a good cause for sunglasses for certain things, extreme conditions. But overall, I think we have a huge fear of light nowadays that's not actually beneficial for our health. But if you have headaches or migraines, or maybe your eye doctor told you could never have a ray of sunshine hit your eyeball, or, you know, you're going to go blind, whatever. Can you talk a little bit about that and what you feel about stress and reducing light sensitivity and overall what your thoughts are when it comes to the stress and how that affects your ability to, because eyes are light receivers, right? We are receiving light through the eyes. And if we are so sensitive, then how can we possibly see?
Well, and I think the sensitivity extends even beyond light. So let's just imagine this. You're in the woods, you see a bear, you're dealing with running for your life, and all of a sudden there's a freaking bright light that comes shining in your eyes. You're like, whoa, like I can't, it could be anything. It could be a loud noise. It could be any light, any stimulus at that point is overwhelming to the nervous system. And this is even outside of the fact that our pupils are, you know, dilating and contracting and obviously taking light in and out in different ways during that moment. But I see this all the time when people are under stress. I had even outside of the light thing, but same concept, I'm getting there, is I remember I was in the kitchen and my son was maybe like 2 or 3 years old and I was focused, you know, I was in a bear moment. I was focused on whatever I was doing. And he came up and asked me for a sandwich and I blew up at him. You know, I was like, what? You got a sandwich? You know, and I'm just like yelling at this poor child and then beating myself up afterwards because I realized I overreacted. I was overstimulated. And when we get in that cortisol fury, we are overstimulated. So any additional stimulation, sound, light, touch, all these things, these senses that are coming at us just almost become overbearing. And I think that's a lot of why the sensitivity of light happens with adrenal fatigue, even more so than just the fact that the pupils are changing with the stimulus as well. It's that we can't handle it. People are overwhelmed, they're overstimulated. And going back to our conversation earlier, when we were saying you need to calm the body to heal, not stimulate it more, because we're already at heightened alert and we have adapted to this. Our body has adapted and our baseline has come so much up that all it takes is one little thing. And this could be a food, right? People with leaky gut, they react to everything they eat. Lotions, people put lotions on their body and all of a sudden break out in a rash that they've never broken out to before. All of a sudden they're becoming sensitive to light. Never was a problem before. These are things that are happening because the body's being overstimulated. And that bear is why you're overstimulated. So by addressing that, you actually see improvements in everything else, in any sort of overreaction by the nervous system, essentially. Did that make sense?
Right. That's interesting. We teach something called sunning, where you go outside with closed eyes and you start possibly in the shade, but we slowly, which is actually really relaxing, right? You get the warm light, but you have to start with baby steps. You're absolutely right. It's like an overstimulation. I think calming versus exercising. I mean, that's a whole trend in the fitness industry too, which is very important. We need to also exercise our ability, our mobility, our flexibility, our strength. But I feel like there's an over focus on that aspect, in my opinion. So
we get hyper focused on that, right? We're just going to lose that 5 pounds. So we're going to go to Orange Theory every single day, count it out. And we're going to eat nothing and we're just going to work out as hard as we can. Gee, I don't understand. Yeah. And then I don't understand why I'm not feeling any better, or why my hormones are going crazy, or why I'm not losing that weight. And it's like, whoa, hold up. Geez, I want to go back to just, I don't know, you got to just be in the moment a little bit and realize that the body has to go through changes in slow ability. And I think it's great that you have people close the eyes and just kind of acclimate. And also they're calming themselves down. And then when the light hits them, it's not as scary. It's not as overwhelming. It's really interesting how fast we can make that change, isn't it? From one nervous system, from the sympathetic nervous system to the parasympathetic nervous system. I mean, in less than 3 minutes. Would you agree?
Yeah.
It's crazy. And that's the thing, is that's free. I mean, you need a guide, you need to get people to get you the techniques, but it's something you can do at any moment, anytime during the day, to take yourself away from that bear, refocus, and get the body to work for you rather than against you. And I think that's just so cool that we have that power. I just think that's awesome.
I actually agree. And I know you're not the ophthalmologist expert here, but I always talk about how the eye exam itself is one of the most stressful things you can experience, right? I mean, there's a whole thing called white coat syndrome, right? I mean, that's a real thing. But then also sitting there, I mean, I don't know how a hearing test is, for instance, similar, because I mean, I've done many of them and I never had any issues. But vision tests were always the most horrible thing for me. Especially when I still had glasses, and it's like, A or B or 1 or 2, and you're like, I don't know. And it's like, it just becomes so overwhelming and you have this fear of failing this test.
Yep.
And so I feel like, and I don't know what your opinion is on this. And again, I know that that's not your expertise, but
sure.
What are you thinking about that idea that, let's say somebody's really stressed. Most of my clients confirm the eye doctor really doesn't ever ask them about their stress levels. I mean, they have 10 minutes, they do the eye exam, they check the eyeball, all that stuff, make sure there's no diseases, which is really important, obviously. But what are your thoughts on this? Then you got the glasses at age 10, right? And I don't know exactly what was going on in your life back then, but probably a lot of stress already, right?
Absolutely.
So, right. So you get those glasses, the eye exam adds another level of stress. I often believe that we get glasses and then we get them and they're too strong. And I think because we were so stressed in that moment that we actually got glasses that are too strong based on this really horrible, stressed out experience. But what are your thoughts on this whole idea of giving, glasses? I mean, especially with children, I don't know. I mean, I know this is not your expertise, but I'm just curious what your thoughts are about, what we could maybe do better with this.
Yeah, I mean, I'm a mom and I'm watching my kids grow up in this world, and I'm watching them addicted to screens and technology and get it now and all these things. And we're setting this example for them, unfortunately. And, I would imagine that the decline in vision is proportional to that in younger children, right? I would imagine. Just like we see more in attention disorders, sleep disorders, mood disorders, I'm sure we see more vision problems in young children. And I think that as parents, and something that I'm actually very passionate about, even though I'm not a pediatrician, is we really need to start to set the example to help these kids access the parasympathetic nervous system, to help them calm their brain. Because if not, we're going to continue to see disease development. We're seeing higher incidences of diabetes. And a lot of people say, oh, it's the diet. Yes, diet matters, but stress is also linked to blood sugar issues. It's linked to every single physiological thing in our body. I mean, the endocrine system involves blood sugar management. It's no wonder that when you're running from a bear, your body is not going to metabolize the sugars well. It's going to have higher levels of inflammation. It's going to downregulate vision, hearing, right? Brain function. And we're seeing all this, and yet we're throwing medications on top of it. We're sending kids to the eye doctor. We're sending kids to the doctor. They're stressed out there. Nobody's asking about stress. I mean, I personally went to the doctor, every year for my annual in my early 20s. Not once did a doctor ask me if I was going to the bathroom. Not once. And I was having all these problems. And when I went into med school and I started studying naturopathic medicine, they're like, well, you're supposed to be having a bowel movement every day. And I was like, I go like once every 8 days. I was going like once every 8 days.
Oh.
And I was complaining of stomach aches, acne, hair falling out, fatigue. And everyone's like, oh, well, here's your birth control pill. Oh, here, you should take an antidepressant, which I denied. I instinctively knew it wasn't that. And I thought, nobody ever asked me what I was eating, if I was going to the bathroom, what my stress level was. And if it was flippant. It was kind of like, well, you're in med school, right? So you're like under a lot of stress. Yeah. You should see a counselor or whatever. Totally dismissed. And I think if we start as parents, if the physicians aren't going to necessarily do it with the kids, we need to do it as parents. We need to start educating our children on how to meditate, how to spend time in the sun, how to put their feet in the grass, pulling them away from the TV and having moments of spending time together in a community. We've lost community. We've lost connection, oddly, in a world where we're connected. We're connected everywhere, but we're the most disconnected we've ever been. And these are having an impact on our kids. And it's obviously going to have an impact on every single aspect of their health, including vision. And I have absolutely no doubt that my vision story could have been totally different. I was under an incredible amount of stress when I was 10 years old, never asked about it. And obviously wasn't having proper nutrition or elimination at that time either. Never asked about it. So I think we have a lot more control over that. We can actually change the health of our entire world right now by just paying more attention to what our children are doing. So I think it's a great point. And I don't think my story is a lone story, unfortunately. I think so many people have experienced that, to go to the physician and feel like they're just being dismissed or ignored. So be your own advocate and be an advocate for your children is my advice. And really look at, are we setting an example for them that will hinder their health? And if they're starting to have vision problems in school, I think taking a really strong look at their stress level and their nervous system, and are they overstimulated, is probably the first start before I would put glasses on. I'm with you on that, 100%.
So what are your, what are your basically, let's say 3 to 5 tips to help, use relaxation, to help see? You have some questions on YouTube about how to get clear vision. Obviously, that's, my expertise, but I know that stress regulation is so, so important. It's the foundation of all my work. So what are your 3 to 5 tips of things that people could do? Because I think it's important that we give some simple things that people can do to regulate their own stress, which will help them see more clearly. And maybe something you can do if you have kids or grandkids, maybe that you can also teach your kids, but we don't have to worry about all the tips being applicable for tips, but for kids, I mean.
They will be, because I look at it from 4 different aspects. And I do talk about this in my book. If you want a basic understanding of that, it's Total Health Turnaround, and pretty much anything I do, all the stuff I put out, blogs and stuff, I talk about this, but there's 4 basic aspects to addressing the adrenal system. Number 1, nutrition. Now I personally am plant focused. I eat a lot of plants for that. It's not so much the diet as much as it's nutrient density. Are you getting nutrients to replenish the nutrients you're losing due to stress? So B vitamins, minerals, gut health. So things like good probiotics, a really good multivitamin, those are, or magnesium. Those are really important things. So getting the nutrients in there from your diet is number 1. Number 2, exercise or movement. And we've already talked about this. This isn't about pushing yourself at the gym. This is about getting out for a walk. If you can do it in nature, even better, because being present in nature. Don't listen or have a phone call while you take a walk. Walk with a friend or get out there and just listen. Listen to the birds. Be present in the moment while you exercise. You will get more efficacy, muscle building, weight loss, if you're calm when you exercise. So try to put those together. Number 3 is supplement, and this is a little bit individualized to people, but when you do go and get a lab workup from a physician, and we can talk about that too, but you get all these different things looked at, you should be able to tell, is your body truly deficient in this, that, or this, and you need to supplement that. There are also amino acids in herbs, some great ones, phosphatidylserine, L-theanine, ashwagandha, rhodiola, shishandra. These are all things that can be used to help balance and regulate the adrenal system. Number 4 is mindset. And this is a lot of the stuff that you work on, I'm sure, with just, and this is the hardest one, I find, because everybody can modify their diet, take supplements and exercise. But the hardest one is committing to really, truly training your brain into a parasympathetic state. There are so many different things you can do, starting from as simple things like just reframing situations, recognizing, hey, I overreacted to that, or hey, that probably wasn't the best situation. How can I reframe that to a positive? We all have stuff that hits us. We all have pressure, and we tend to succumb to it. So at the end of the day, sitting down and saying, all right, this wasn't great today. This was not my favorite part of the day, but what did I learn from it? How is this going to benefit me in the future? How is this now a positive for me? I think that part, if you want to talk about something that somebody can implement right now quickly, it's starting to recognize, what are my bears? How do they impact me? And how does this grow me as a human? Rather than, what did this do to me? Oh, woe is me. Oh, everything just keeps falling down, right? I've been at that low point where when my mom died, I didn't know if I was going to go on. It was so lonely. And my whole family was gone. She was, very, very close to me. And I mean, I went through 9 months where I didn't even call my best friend. I didn't ask for help. I didn't feel that I was worthy of asking for help. I didn't feel like, I didn't want to be the victim where everyone would be like, oh yeah, whatever. I was going to do it on my own. I was going to power through. And if I could go back in that and see what I see now, that experience of me going through that is what brings me here to inspire others, to educate others, to help other people prep themselves for situations like that. It was the best gift I've actually ever been given, because it changed my perspective on life. I'm far more present in my life now, far more present with my kids, experiencing a better life now because of that tragedy, and in the moment, it's so hard to recognize that, but there is beauty and light in every single thing. And so the number 1 tip, recognize that stress will happen, but there's beauty in the process. And by recognizing that, reframing it, and putting a different light on it, you will start to turn that big, scary bear into a little bear cub. And then when you start to implement the diet, the exercise, and the supplements, it becomes just the spore-pronged approach that starts to truly up-level your health.
I love that. So what was the thing about the bears? Like, what are the bears? What was the second thing about it?
What are they? What can we do about them? Like, one of my best favorite questions is, can I do anything about this situation? I mean, because so often we're like, oh, this is awful. And then I'm like, okay, I have literally no control over the outcome at all. All I can control is how I react to it. That's the
Right.
only thing I can control. I can't really change the situation. I encounter people who maybe are in a bad mood and they try to ruin my day, and I can go down on that. I can just be like, ah, this sucks. Or I can say, well, I have no control over their mood. I mean, I can smile at them and see if I can make them feel better. I have a habit. My kids hate this about me. When I go to the grocery store or I go somewhere, I smile at strangers. That's what I do. And I do that because it kind of like snaps them out of their bear moment, because they're like thinking about all this stuff and they're grocery shopping and I can see they're not really present. And I'll just walk by and say, oh, hello. And I'll smile and they stop and they smile back and they say, well, hi, how are you? Oh, I'm great. And I keep going. And little things like that not only lift someone else up, but lift your own psyche up. And you start to recognize how often you're in that. And so if you're ever in Arizona and you're in a grocery store and some random 6-foot tall woman walks up and says, hi, today, I want you to snap out of your moment and realize that you were stuck in a bear moment and it's just a cub and it's not a big deal and we all move on. And those are things that I think it sounds simple. It's like, oh yeah, just change it. But oh my gosh, it's so powerful if you can really get in practice of doing that. It's incredibly powerful. And then, you can expand, you continue to expand and grow in these other areas. Nobody is going to do this perfectly. Nobody. Even me, I don't do it perfectly either. I have bad days. There are days that I get brought down by things and I have to remind myself it's just a day in the course of my life. So don't go into it thinking I'm going to do perfect nutrition, perfect exercise, perfect supplementation, perfect mindset. Perfection isn't really fun. I think there's a lot of fun in the flaw, a lot of fun in the moment that we need to embrace a little bit more. And can I add one more thing?
Yeah, sure.
I just thought of it. Why not? I just thought of it. I know we're close on time. One of the things that I've kind of started telling my clients a lot is think back to when you were a kid. What did you really enjoy to do? What was your favorite thing to do? When you were stressed or you're in that moment, what did you do to just kind of be lost in your own moment? For me, it was dance, which is why you see me dance a lot. Find that creative thing that you really, really, really love to do and bring it back as an adult. Because it allows you to remove from the left side of the brain, focus on the right side of the brain, calm down, enjoy, and find that joy. And that will reduce stress as well.
I absolutely love that. Coming back to the little things, the things that we really love to do. So thank you so much, Dr. Tricia. We have all the links where people can find you. Maybe you want to say one more thing where people can find you, but we have all the links underneath the video, your website, your Instagram, I think your YouTube, and also you have some kind of gift or something that people can get, right? Tell us a little bit about that.
Well, I provided a link to my adrenal fatigue quiz because I do think often we don't realize how much stress is impacting us. I'm going to also, after this, send you one to my lab list, the labs that I run every single year. I think that'd be really helpful. Everything you can find on drpingel.com. If you're looking for my book, you can find it on Amazon. You can find it on drpingel.com. If you do come and follow me over on Instagram and enjoy the dancing and the joy, say hello, tell me where you found me, join in the conversation. This is, my goal here is to bring us all back together and connect with each other and use each other to lift each other up and be well. So please reach out, say hello. And it's nice to meet all of you virtually or otherwise, or in the grocery store someday.
Well, I absolutely love that. Thank you so much for that conversation. This is it for YouTube. Thank you, everybody watching live. And obviously, when the live stream is concluded, which is happening in a few seconds, you can always comment underneath. And Dr. Tricia and myself will do our best to answer any questions that you have about the adrenals, cortisol, the connection to vision, and any other questions you have. So thank you so much, Dr. Tricia. We really appreciate